Good morning. Good morning, everyone.
Good morning, Kelly. How are you?
I'm doing well, thanks. How are you all?
Yeah, doing good.
Good.
Doing good myself.
Happy New Year. Most of you I haven't seen yet or talked
Yeah,
to yet.
yeah.
2024, here we are.
We did it.
We'll just wait here for a minute. There's some others joining, so hope everyone is staying warm where you are and safe. The weather's been a little wintry the past couple of weeks. Okay, just wait one more minute here. Welcome, everyone who's just joining.
Good morning.
Hello. Welcome. Okay. Well, it is 9:02, and we have a as always, pretty packed agenda today. So I'll get started, and as others trickle in, we can get them up to speed. But welcome officially, everyone. Like I said, I haven't seen a lot of you or talked to most of you since 2024. So here we are, a Family Childcare Network meeting, the first one of 2024. Super excited that we have Joan Blau and Alan Oman here today. A little bit later in the session, and they'll be catching us up on all things Family Childcare Network policy and kind of where we're headed. But for now, we're going to get started by just reviewing our working agreements that we have created as a group, which we decided that are important for all of us as we're meeting and collaborating together. So I'm going to go ahead and share my screen, put this into space for us to be grounded in our time together. So I'll just go ahead and quickly read them off to the group. All questions are welcome. Safety and sharing things that are going well and that are not going well. There will be ample time for participants to process and share. We'll be open and aware of different perspectives. We will provide and complete advanced preparations, including sharing an agenda. This is a safe space and a collaborative learning environment, and we will share resources and not reinvent the wheel when possible. As always, if after we have our time together today or at any time, if you think there's something missing from our working agreements, please feel free to reach out to me or Nicole or bring it up in the group if you feel comfortable to do so. Okay, so our focus this week, or I guess this month, is benchmark F. This benchmark focuses on ensuring that providers in our networks have access to the supports that they need to directly impact positive child and family outcomes. When we're creating these supports or providing these supports, of course, we want to make sure that we are building them in a culturally relevant way and tailoring them to the strengths and assets that the home-based childcare small business owners in our networks already hold. So today, our small group discussion will focus on how the networks you are supporting are doing this and implementing this benchmark. So here are the directions. You will be placed in a breakout room with your organizational team along with two other hubs. And as soon as you enter your breakout room, choose someone who will be the note taker and someone who will record your examples and conversation learnings out to the group at the end. We will have a large group discussion to debrief after. And then you will be answering the following questions. How are you connected to the existing mental health infrastructure in your community? And how are you promoting those connections to the providers in your networks? So, for example, maybe your organization provides trainings, you're a training organization, or you support a way to link childcare providers to trainings around mental health and social emotional supports. So think about how are you creating infrastructure around professional development that makes the offerings contribute to provider growth. So maybe your network staff are taking time with network members post trainings to support them in thinking deeply about what they have learned and what they will implement. Maybe you are making home visits after trainings with providers and thinking about the training that they had attended and how they will be implementing in the space that they have. So that's question one. And question two is share an example of how the network has intentionally built on and or enhanced culturally relevant, community embedded provider practices. And then the follow-up question is how have providers seen this contribute to positive child and family outcomes and positive outcomes for themselves as professionals or business owners? So we'll make sure to go ahead and put those questions in the chat as well. But I did want to quickly just show you the Jamboard. I'm not sure how many of you have used Jamboard, but it's pretty simple. I'm going to just go ahead and walk you through it really quick. Okay, so you'll see here when you have you'll receive the link to the Jamboard and you'll see your group and then the organization. There's two. This is how you navigate the notes or I guess, pages. And each group has one for each question. And then whoever the note taker is, you can either use the stickies to take notes, or you also have the option to do a text box. So whatever you prefer. The sticky notes don't hold as much text, but they hold quite a few characters. So we're using Jamboard so that during our breakout or our large group debrief, we can all kind of see, and for those of us who are visual learners, see your discussion. And then we'll also make sure that we share out the Jamboards at the end of our time together. What questions might anyone have about this small group discussion activity that we're about to participate in? Okay, sounds good. Sable, how are we doing with small groups? Perfect. Okay, so we'll go ahead and break you out. And you'll have, I should have told you this, you'll have 25 minutes. If you have extra time at the end of answering, everyone taking a turn to answer these questions, you can just go ahead and think of another example of a support that you are offering through the network. We'll see you soon.
Welcome back. Welcome, welcome. Thank you for being patient with us as we navigate our digital literacy. We know there's a way to send you all items in the chat without being in the chat room with you, but did we know how to do that yet this morning? Not quite yet. So we'll have to do some investigations on that. I said I felt like I was time traveling, jumping into the rooms in and out. Welcome back. Looks like we're getting everybody else. Wonderful. And I'll say to the rest of you, thank you so much for being patient as we navigate our digital literacy and getting you the links to the Jamboard, but it seems like we got it figured out. So we're going to go ahead and do a full group debrief. And you know that we gave you 2 questions, and we always know that we don't always get to those 2 questions. And so what we want to do on our debrief is we're going to share the Jamboard, and hopefully you all identified a reporter that will share out on your behalf. And then we're just going to give you the opportunity to share out on whichever question you want to share out on, seeing how I don't think that we're going to have enough time to do both. And maybe you didn't have time to do both in your small group anyways. So we'll go ahead and get started. I think we have a group 1, 2, and 3. So we'll just go ahead and start with group 1. So whoever would like to do the reporting for group 1, we can go ahead and get started. And you just let us know which question you'd like to share out on.
Sounds good.
Sebastian, let me add one more thing, is that you have about 3 minutes. So I'm going to be your timekeeper too on that.
Excellent. I'll power through.
Sounds great.
Okay, so I think we had like our conversation at the end was really rich and good, and we were talking specifically about the positive outcomes for the providers as professionals and business owners. That's like on that right-hand side there. And so a couple of things that we were talking about was that we were seeing from, we've been getting a lot of feedback, obviously, because we're doing our wonderful 6-month reports. And so we're getting a lot of feedback about providers saying that they feel supported, and specifically that they no longer feel like alone. And so we were talking about the well-being that comes from working as a group. One other thing, kind of tie into the cultural competency question just a little bit. We talked about the benefit of receiving training as a group as well, especially around cultural competency and things that are perhaps more sensitive topics. There's something, again, that supports your well-being if you do that in a group, because you can get in the conversation a bit more deeply and perhaps more safely as well if you're around people that you trust and have built relationships with. So we also had some wonderful quotes about feeling like they're a higher quality provider without adding cost to the family. So that's really a nice benefit, again, to themselves as professionals. It's a big thing for us as well to always be looking for that increase in agency among providers. So they're really taking on a lot more. And as they increase agency, they feel more confident to take on things like policy advocacy or things that in the past had seemed really daunting or like overwhelming for one person to take on. They are now like, you know what, we're going to take this on as a group, or you know what, we need a training on this. And I think that shift into like action has really helped well-being overall. So that was our group conversation there.
Thank you, Sebastian. So that's awesome. I was just thinking, like, this just means grounded in community, and it just goes back to all the principles we know to be true about early childhood. So like we're right on track. All right, thank you. Group 2. Who's our reporter for group 2?
Sorry, I couldn't get my, we didn't have time to assign a reporter. I took notes and I don't want to take all the glory. Does anyone else that was in my group want to report out, or otherwise I can? Okay, I'll go ahead. So we had it within our group, some that were forming new groups and some with groups that have been in existence. And one of our group just recently had a team retreat with their FCCN leadership advisory team. And that took place at a hotel with the time just to be off radar, connect, relax, and interact. We talked about relationship building opportunities among network members woven into the program through the one-on-one home visits, potlucks, peer-to-peer engagement opportunities, really building those relationships for that support. In-person monthly meetings for topical discussion, relationship building with coaching and one-on-one follow-up. Social emotional support needs have not, we did say that specifically social emotional support needs have not been expressed as a high need among networks. However, realizing and seeing the need to define what that is and what that looks like so that providers know, like they maybe have a certain understanding of that and don't understand the full spectrum of what would fall under that support. So some additional education opportunities there. And then supporting providers with education on mental health or early childhood developmental resources in the community and helping to facilitate those connections, navigating services and community resources. And we really talked about those one-on-one, not only the building the network relationships, but those one-on-one relationships. And within our team, we had someone who operated a home-based childcare business, and they expressed that that was key. Having someone come in on a regular basis that they could talk to about things and about needs that they didn't necessarily express in a larger group.
Thank you, Kim. I think that you've really gotten into something on the social emotional understanding piece. And it just reminds me that oftentimes when people are in crisis or have been experiencing like environmental stressors or systemic stressors for a long period of time, you don't remember something different, or maybe you were never introduced to something different. So you don't even know that, you know, health and wellness support is something that you need, or how that's connected to social emotional learning. So I think that's really important. And I love the idea of being able to tap into those conversations one-on-one based. Thank you. All right, so we're going to go to group 3. And who's our reporter for group 3?
I said I would do it, but folks feel free to jump in if I miss anything.
Thank you. Oh, and Kelly, can we move over to the...
Is my screen not sharing?
It's sharing, it's just not moving the cursor.
Oh, I'm so sorry. So
There we go.
sorry. Got it.
There we go. All right, thank you, Kara. Go ahead.
All right, so we had a really nice conversation, excuse me, a nice conversation about specific things happening in each of our groups, but we had some really interesting takeaways. We talked a bit about how the work that we do is very relationship driven, and the work that our providers are doing is very relationship driven, and sometimes it can also be very isolating. So finding a space for them to be able to connect beyond just talking about their work in childcare, but on deeper levels with the folks in their network is really important. And we talked a bit about how, you know, there are so many ways to do this, but potlucks came up in our group, and I feel like I've heard it before in some of our conversations in this group. But having just opportunity for folks to be heard and be seen was really important. So everyone kind of touched on that. First Steps Kent talked about working with Opportunities Rise Mental Health, and that there was a request for a potluck for an in-person meeting where they would have originally had a Zoom meeting. And so just being responsive to that for their network. And then for SA Hands Connected, we've formed this advisory team. We have a lot of opportunities for feedback so that we can be truly responsive to the unique needs of our providers. We've added in my role as education specialist as a result of some feedback. And there may be some additional additions to the team based directly on feedback that we're hearing in those spaces that we've held for providers to come to us. Great Start to Quality brought in mental health providers that were native Spanish speakers. And they continue to provide coaching sessions for the folks that they've partnered with from that larger group setting. Oh, that's supposed to say text, sorry, group text message. Just a very casual but meaningful way that people have been able to kind of pop out of that isolation and be in dialogue with each other. Anything I missed, y'all?
All right. Thank you so much for those report outs. I love that overall it's all grounded in building community and relationships. And so like we said, what we'll do is we find it really helpful to have these collective answers from the debriefs to share out with you all. And so part of our follow-up will be these Jamboards, so you can have them, reference them, reflect on them. So now we have built in just a quick little 5-minute bio break for you. So we're going to go to our bio break. And when we come back, we're going to get to hear from Joan and Alan. So go ahead and we'll take a minute and we'll see you soon.
Welcome back, everyone. I am very excited that I am able to introduce Joan Blau, who is the Senior Director of the Child Care Innovation Fund, and Alan Oman, who is a Senior Advisor at the Early Childhood Investment Corporation. They are going to talk with you all today about the Family Child Care Network Act, how we got here today, and then a little bit more about what to expect in the future. So welcome, Joan and Alan.
Hello, everybody. Great to see all of you. And thanks so much for being a part of this important work that we're privileged to be able to undertake here in Michigan. So I understand from Kelly that there's been questions about sort of like, how did all this come about? So I'm not going to say this is the only version of the story, but I think this is a pretty accurate version of the story, at least as far as we understand it from the perspective of ECIC and my own personal involvement in the Family Child Care Network work in Michigan. So I know that you all may have questions as we go through our time together, so you could feel free to put those in the chat, and then we'll take pauses. And I just like to always remind everybody, there's like no stupid questions. There's just curiosity. And so please share your curiosities with us. Our goal is that you leave this time with us today and you feel like you got a little more grounded in where this work came from and what our intentions are associated with working together with you and hopefully many others to obtain the funding to sustain this work, which will take all of us for sure. So let me talk a little bit about the background. So in 2018, the then Michigan Department of Education worked with myself. I was running my own business then called Change by Design, and they contracted with me to complete a family childcare network project. I was working with Lisa Brewer Walraven, who is our state's child care administrator for the Child Development Block Grant, the CCDF Block Grant, and a longstanding leader in the field of infant toddler services, Renee DeMars Johnson, who has since retired. And the two of them really were interested in seeing if they could work within the Department of Education to do a pilot of family childcare networks, because there's a lot of really great research evidence emerging across the country at this time about what a powerful intervention this is for childcare, family childcare business owners. You're going to hear me talking about family childcare business owners. That's a frame that we're really trying to use as we talk to legislators and as we're putting together resources and materials. We think that's an empowering term and really helps us to frame for folks who may not be familiar. Provider can sound like, oh, does that person even own a business? What's a provider? Whereas when you're directly saying family childcare business owner, you're like, oh, this person's a business owner. Well, that's a different frame that most people have about what it means to be a business owner than a provider. So you'll hear me use that. So don't be surprised by that. So what I was charged to do was to prepare at that time what was a preliminary request for proposals and actually a State Board of Education item. So anytime you take something before the State Board of Education, you have to make a request for what it is you're asking them to do. this was intended to result in funding for family child care networks, but this project that I worked on did not progress. Unfortunately, there was no funding. So in 2021, we started the Child Care Innovation Fund here at the Early Childhood Investment Corporation, and had an opportunity to really start to talk about ideas and innovations that we thought were really powerful and important. And one of those was family child care networks. And I had been working out in Oregon, as some of you know, and that was our primary strategy for working with home-based childcare businesses. So many conversations ensued, and there was an opportunity, some interest by Michigan legislators, including Representative Breen, who I think ended up ultimately being the sponsor, one of the sponsors of the bill, to pass some legislation related to family childcare networks. And the reason this happened was because a lot of conversation had taken place about concerns that were coming to legislators about how difficult it was to sustain these home-based businesses that were really providing important services, and that networks were shown as a really powerful strategy for sustaining. And so the Family Child Care Networks Act essentially quantified what is a family child care network, and then it directed again, then MDE to pilot and to start to do some work in this space. So one of the first things that the department did is it partnered with the School Readiness Consulting, which is a national consulting firm that specializes in early childhood, to prepare a report that was called Michigan Family Child Care Networks Final Report. And what this report did was it reflected interviews and other information that School Readiness Consulting had gathered through talking to many stakeholders in Michigan. It also brought forward examples of powerful network strategies that were being used by other states, and was an important, I think, sort of seminal publication that said, okay, at this point in time, when this report was issued, this is what we understand. Interestingly enough, sort of on a parallel track, two national organizations that have a long history, so to speak, of working in this space had been working together to, because some of the feedback that was happening in our field around family childcare networks is like, how do we know if these are really good, right? Like, we know the difference, I think, as individuals between a training that's kind of and a training that really gets us fired up and makes us want to go out and do things. Well, participating in a network is the same. There's a difference between a network that's kind of and maybe I go once in a while, but I don't attend all the time and I don't tell other people about it, and a network that's, wow, this is actually helping me solve my most pressing problems as a home-based childcare business. I'm really connecting with peers. I feel treated equitably. My voice is heard. I am seen. I have a leadership role. So Homegrown and the Erickson Institute in Chicago worked with Family Child Care Network members across the country and staff like yourselves. They looked at research, they talked to leaders, and they put forward the best thinking that exists around the 11 quality benchmarks, which all of you have been working on. Then the Department of Education, under the Caring for My Future initiative, decided that it wanted to invest $4 million in family child care network pilots. And they put out a request for proposals, which was competitive. And the Early Childhood Investment Corporation Child Care Innovation Fund wrote a proposal, and we were lucky enough to be selected. So as you know, we're currently in our pilot period of family child care networks, and that we are using these 11 quality benchmarks and the other work that Homegrown and the Erickson Institute have been leading to help us really have a framework for this work that we think is strong and helps us collectively be able to make the case for the importance of this initiative continuing. So as you are aware, we have 3 primary goals with the Family Childcare Networks, and I do really think it's important to keep these out in front of ourselves kind of collectively all the time. So one of those, the most basic, of course, is around connecting and supporting home-based childcare programs in the delivery of essential services to improve program quality and strengthen home-based care. I noticed as I entered, you all were talking about a really important essential service, which is access to mental health consultation and support, both for children, ideally when needed, for the program, for individuals working in the program, and also, if need be, helping family members who might be suffering a mental health crisis, who are taking advantage of the services of the childcare to be able to have a referral to mental health services. So lots of opportunity to help support wellness is a great example of essential services. So the other goal of these networks is really to, on primary directed from all of you as hubs, which is how are you really building the capacity of these networks through your technical assistance that you're providing to them, your consultation, your coaching are really important forms of technical assistance. You're helping, listening to them, you're creating educational and engagement opportunities. And this is where we start to get into the space around improving the policy, economic, and regulatory environments. Because this is a federally funded initiative, we don't talk super directly and publicly about advocacy because it's simply not allowed. So what we talk about and what we need you all to talk about is that we all need to collectively work together around engagement and educational opportunities with decision makers and policymakers. So it's within all of our rights with this federal funding to educate. And it's also perfectly fine for all of us to engage. And I know Alan will maybe talk a little bit more about that, but we want to de-emphasize in any kind of publicly materials that are publicly distributed, that are funded with this grant. We really do not want to use the word advocacy. That will be problematic. You can certainly talk about advocating, but in general, when we're calling people together, when we're inviting them to do things, we really want to emphasize that this is an educational opportunity and that home-based childcare business owners have important stories to tell about their experiences, and that their voices are crucial in helping us to improve the policy, economic, and regulatory environments here in Michigan. So the Family Childcare Networks Act has a number of sections, and what Kelly has on the screen right now is Section 10. Now, when this act was written, you have to remember the benchmarks weren't available. They weren't published yet. Otherwise, there's a very good chance they would have been linked in here. So at the time this act was written, our best understanding of what a network must offer was this list. So individualized coaching to individual childcare business owners, training and professional development around key things, developmental screenings, health and nutrition, program quality. You heard me talk earlier, mental health consultation. Connections to peers, obviously, it's so important. That's why we're doing a network and not just individualized connections, is that peer-to-peer learning is a very powerful strategy and has been proven in many research studies to be crucially important for decreasing that sense of isolation that often drives people out of providing home-based care. And that expert consultation that you all provide is very important as well for changing quality practices. So both things matter. That's why they're both listed on here. We want, the Act talks about the importance of operational supports, things that we know are already challenging for people: licensing, subsidy billing, and recruiting families, because full enrollment is crucially important when your business model is so tight. When you only have 6 or 12 children, if you're not fully enrolled every single day, that is going to be a fundamental drag on your business. Business services, tax preparation, human resources support, professional development for network staff like yourself. And then, of course, data collection and evaluation. Hopefully, as you're hearing me kind of go through that, you're thinking, wow, there's a lot of alignment with the benchmarks. Yes, there is a lot of alignment with the benchmarks. And that's why we were able to work with the Department of Education to say, we actually think the benchmarks are what we should use as the framework for this, because it helps us connect this grant opportunity to a national effort to build the value of home-based childcare, and to really ensure that we've got the policies, financing, practices that we need to build up home-based childcare. Most states across the country have seen a steady erosion in their home-based childcare businesses over the last, 7 to 10 years. And that's very problematic when a key part of your childcare industry, so to speak, is shrinking, when we know we have so much unmet need, and particularly for the kind of care that's often provided in home-based childcare: after hours care, weekend care, 24-hour care. Those are not typically provided by center-based settings. And we know that with the incoming industry in Michigan, or even what we have now, healthcare systems, people don't work only 9 to 5. They, especially many of our families who are most furthest from opportunity, really need care in those outside hours. So this act was an important step in the process of allowing the Department of Education then to be directed to put funding towards the pilot. And that's where all of you came in. Your organizations successfully applied to partner with us in this pilot, work on those goals, and to hopefully be able to use this year of funding to make the case for funding to continue, and to actually hopefully increase or expand over time, so that we could have statewide coverage, so that all home-based businesses over time that want to could be a part of a network that would help them do all the things that are represented in the benchmarks and also on this screen. And I think that is, what's that? Yeah. So I will just touch on this a little bit, and then I'm gonna have Alan kind of take over. We can answer questions that people might have. So where are we headed? So we are actively thinking about sustaining the family child care networks. We have been actively educating our partners in MyLeap. I know we have support from Lisa Brewer-Walraven, who's very interested in having this continue. We've been talking also with Michelle Richard, who's now the acting director of MyLeap, and with Emily Laidlaw, who is taking on a bit of a leadership role within the new state agency for early childhood. So we're actively talking about how important this is going to be. So one possible funding source would be from the MyLeap budget. Other possible funding source, and the typical funding source that's used across the country, is the Child Development Block Grant, which is a federal block grant of funding, a large package of funds that comes to states on an annual basis, most of which is used for childcare subsidy, but also includes funding for quality supports, and family childcare networks are understood as a intervention or strategy that supports program quality. Of course, general funds from our state could potentially be directed. We also have work that ECIC is doing with regional coalitions across the state that are focused on understanding and building childcare supply. So for example, we know that many of those regional coalitions are interested in building networks in their region for family childcare and also for center-based childcare. Because as they've been looking at what's happening in communities across the state, they can see that your individual businesses are really challenged to meet all their needs alone, and that a network is something that can really both sustain and promote business expansion. We're also looking at unusual suspects like the Michigan Economic Development Corporation and our small business supports here in Michigan, to better understand how they might also be able to contribute. Possibility also within regions or communities is how might essentially what I would call an ask be put together that could be supported by major employers in the area. Because, for example, a network of family childcare businesses might work with a corporation or a couple of corporations and do something like contracted slots or holding spaces for employees, or the corporation might play. These are all innovations that we're starting to see emerging. So I think that's all I want to say. And then I think, Alan, I'll let you offer what we can say today, not having heard the State of the State address and not having seen yet the governor's budget.
Thanks, Joan. So I just quickly wanted to introduce myself. I know some of you, and some of you know me through other elements of my work with ECIC, and even before I was at ECIC. As Kelly said, I'm a senior advisor with the organization, and so that means I work with multiple teams, including the Child Care Innovation Fund team, but also the policy and advocacy team. And as Joan talked about, there are some opportunities and challenges when it comes to delineating between what is advocacy or lobbying and what is education and engagement. And so at a very high level, I wanted to offer some support to your networks and you as individuals, to say that the ECIC policy and advocacy team is here if you need guidance, engagement, if you have strategies that you want to talk through. We are definitely here to support you, and feel free to reach out. I know some of you already have engagement strategies either through your existing local networks with the business community and chambers, or even at the state level. Some of you, your organizations are engaged with state partners such as Michigan AYC to do some education and engagement with policymakers. On a very high level, just a very quick and dirty explanation. So, for example, is using the strategies that Joan talked about, the funding sources that Joan talked about. It is possible that we will see new funding opportunities, new bills come through in various state budgets. So lobbying or advocacy would mean that you actually engage in supporting those funding strategies and talk to policymakers about supporting those specific bills and funding strategies. And that is something we cannot do. That said, your local childcare business partners are independent partners, and they can engage in that because they are not directly funded through federal dollars. What you can do with policymakers is reach out and share the work that you're doing, the accomplishments you've had so far as part of your networks, and lean into the critical, important role that home-based providers play in meeting the needs of working families in the state of Michigan. The one, and Joan touched upon this, the one thing I would kind of throw out there as a potential opportunity and question for you is we're not likely to hear a lot of explicit details tonight in the governor's State of the State address. Typically, the address covers a lot of ground in terms of the priorities for the upcoming year, and it's typically not more than an hour. So you might hear some very quick passing references to some goals or strategies that the administration is leaning into. And the formal budget will be proposed and released publicly sometime in February. But it's I would be surprised, let's put it that way, if the governor doesn't at least make reference to the administration's priority around universal pre-K. It's certainly the biggest piece of the early childhood pie that the administration is looking at right now. And I would say, while this may not be referenced tonight, what we have seen so far with the expansion of universal pre-K is a lot of focus on the existing GSRP program, which is a center-based model. A lot of a big part of that is school-based programming, and then there's a significant component for community-based childcare centers. I think the administration is starting to realize, and the leadership is starting to realize that there has to be, if pre-K is going to be truly available to all families in Michigan, that there has to be some additional strategies employed and expansion to expand the access and availability of pre-K. So it is possible that we will, in the governor's budget in February, we will see strategies, either pilot initiatives or outright funding strategies that would provide opportunities for home-based providers to participate in universal pre-K for all. That would be new and untried up until now in the state of Michigan. There are strategies that have happened in other states, but this would be new for Michigan. My question for you is, if that were to happen, how would you lean into supporting the home-based providers in your communities and in your networks with engagement and participation in receiving those funds if they so choose? Many of them are already supporting or are providing care for 4-year-olds in their home-based settings. If there was an opportunity for them to access this new funding source, and there were requirements in terms of that they needed to meet to access those funding sources, do you have strategies in place to both educate and inform the providers in your network, but also provide support for them in terms of navigating their path to receive funds? So we don't, as I said, we don't know yet exactly what the strategy might be in the budget, but I would not be surprised if there's at least a pilot path included in the governor's budget proposal. So with that, I'm going to pause, allow you to ask questions. But as I said, both myself and the rest of the policy and advocacy team at ECIC are very much here to support you and help you with your education and engagement efforts, whether that's locally or regionally with your with your local partners or at the state level with policymakers in the legislature. So, questions?
Hi, this is Shanae and from Vibrant Futures, and I'd love to follow up with you. And just in the last thing that you mentioned about the pre-K for all, I was actually on the work group to craft the roadmap, and I just want to ditto what you said around. In fact, I was probably one of the main advocates on home-based childcare, getting into that roadmap. And I will tell this group that the biggest pushback on that, and this is to say, what do we need to make sure we're positioned to do? And the biggest pushback was on whether or not home-based childcare could deliver quality. And so we need to be able to speak, and there was quite a bit of opposition, and that kept being reframed. And with evidence. And so I think we've got to be positioned. And I think what you'll see is, because that's still a leap to get home-based childcare in there, is to make sure that we double down on specific things, unlike quality, whatever that means. And I think it could look like longevity and levels and folks who've been in the business a long time. I think you're going to see requirements around that.
Yeah, first of all, thank you for that, and thank you for your work with the advisory team that put together the report that that is supposed to be released before the end of the month. So probably we'll see it released right after the State of the State address. But I could not agree with you more. That we do know that there are perceptions around differences in quality in center-based pre-K, especially a bias towards school-based systems. You know, the pre-K system in Michigan has been funded and operated through the Michigan Department of Education up until the creation of Miley, and through the intermediate school districts and the local school districts. And so there isn't a bias perhaps towards school-based programming. And then there are concerns and fears among both folks at the department level and regionally or locally at some intermediate school districts about whether or not home-based providers can reach the perceived level of quality. But I would say I think we have a very strong argument to make. I think we have opportunities to educate, engage, and quite frankly, push back on what are some of the defined indicators of quality. And quite frankly, I think the biggest argument that needs to be made is one around parental choice. A center-based, school-based model is not the option that every family would choose or want. And so if we are going to have a healthy and successful universal pre-K system in the state of Michigan, it has to be a mixed delivery model. There has to be opportunities for choice, and it has to include the private sector, nonprofit sector, both center-based and home-based providers. So thank you for your comment, and thank you for your work in getting us to where we are today.
Looks like Mary, you have a question?
Yeah, I wanted to comment regarding quality. So we already know that home-based is providing high quality and is more than capable of being able to provide it. But one of the operational challenges that they face is not being able to access subs. And that's something that we're working on in our area pretty hard. And I know that United Way of Northwest Michigan has a lobbyist, and that lobbyist is having some conversations. And whenever I hear this argument about it's not quality, and then people start taking down the list, well, and they close because, the provider has a doctor's appointment. A lot of that is structural in our system, and we can fix that. And I guess the other thing is, what better incentive for home-based providers than to be able to participate in a program like this and draw down a consistent revenue source? And what better incentive for them to continue their education and continue to embrace quality? So let's make this happen.
Very
Thanks.
well said. Thank you, Mary.
Yeah, absolutely. And I think the networks are one of the rationales for how to support this. Like a key strategy to supporting home-based businesses to provide pre-K is the network that they're a part of can help to provide that staffing, make sure that the paperwork and administrative burdens are shared. They don't fall on every single individual business alone. So how does the network hub, you're the back end of helping to make this happen. I mean, that is in all likelihood will be something that will be vocalized, right? We need network supports. We need a way for the providers and communities who are going to be hopefully engaged in providing getting funding for pre-K, so that it's like we don't have to worry. Because not only do we have great individual businesses, they're part of a strong network that is ensuring that these other things are happening. So we will obviously, I'll talk a lot more once we see what's in the budget, but I think exactly what you're talking about, Mary. We got to position, we got to reframe what people understand. We got to get our business owners talking, and we got to sell this network work as a part of the whole piece. It's all one thing. Looks like we are almost at our time. Shanae, is your question or comment quick?
Yeah, I can make it really quick. And I think that's why it's so important that you brought to us an evidence-based model, because the discussion at the table was about where is the evidence. So in the advocacy and the pushback, it was about the evidence of such.
Thank you, Joan and Alan, so much for being here today. And thank you all for your continued efforts and hard work we all know you're putting into this. I will make sure to send the link to the survey to you all as a follow-up. There also are a few things that Joan and Alan mentioned that they are in the share drive, but I will go ahead and forward them to you so you don't have to dig through that for your reference. But thank you all again. I hope that you have a great rest of your day. Take care.